Once you've had your surgery, what's the best way to recover? And how do you ensure that you're doing everything you can to have the best and smoothest recovery possible? Today we're going to talk about some of the things you can do to make sure that your recovery is nice and easy and you get back on your feet as quick as you can. I'm Dr. Peter Vila, and I'm a facial plastic surgeon. So one of the common questions that comes up is how quickly can you get back to work? And it really depends on what you've had done. Now oftentimes for rhinoplasty or a nose job, that does require making little cuts in the bone, and so that can cause bruising. And so that bruising tends to be out here. In most people, by 10 to 14 days, most of that bruising will be gone. Rarely it persists, but at that point it can be covered up by makeup. Any surgery where there's stitches on the outside, like a facelift or eyelid surgery, those stitches are going to be there for about a week. Once those come out at the 1 week visit, then you're still going to have a little bit of swelling and redness that's going to slowly go away. By about 2 weeks, no one else is really going to notice it. You'll still be able to feel there's a little bit of lumpy bumpiness, and generally by about 3 months after surgery, that will have been completely resolved. Now, it's very important that immediately after surgery, in that first week, that's really where you're going to do all the things that you can to make sure that you're recovering as quickly as possible. So what can you do? First thing is icing. Ice helps shrink those blood vessels up and decrease the amount of swelling that you have. So in the first 48 hours, really just the first 2 days after surgery, that's when you're gonna ice. So if you had a nose job or rhinoplasty, you're gonna ice right here. If you had a facelift, you're gonna ice back here over the incisions. Beyond the first 48 hours, icing is not gonna do anything, so you don't need to waste your time. Now, I'm a facial plastic surgeon, which means I only do work on the neck and up. If you had surgery on another part of your body, this would also apply, but keeping your head elevated is something you can do to help decrease the amount of swelling. So if you're laying in flat, you can imagine all that swelling is going to rush in, and when you wake up the next morning, it's going to be a lot more swollen and a lot more painful. So what you can do is prop your head up with a couple extra pillows when you're sleeping at night, and during the day try to stay upright so that all that swelling drains down. It's going to go with gravity, so if you keep your head upright, it'll minimize how much swelling gets in there as your body is trying to heal the new wound that we just created. Now, if you do have incisions on your face, you're going to want to keep those clean. So what does that involve? I'm a huge fan of Aquaphor, so if you don't have any Aquaphor, I would go out and get some before your surgery so that you just have it at home. And what you're gonna do is every day you're gonna just very gently wash that incision with a soapy hand. You're not gonna scrub, you're not gonna really put a lot of pressure on it, but just enough to get the little crusties and stuff that wanna form off of it. If you need to, and there's really a lot of crusting on there, don't use your nails, don't really scratch at it. You can use a Q-tip with some hydrogen peroxide and very gently just get those little scabs off on top of the sutures. The way to prevent that from happening is to use Aquaphor 3 times a day. So after your warm, soapy shower, you're gonna get out, dry it, just pat it dry, and then apply a nice thick layer of Aquaphor. And what that does is it provides a barrier for no bacteria to get in there, and it also keeps the incision nice and moist, which is a good thing, and that encourages good wound healing. Now, as far as pain medications, most people will take the prescription pain medicine 1 to 2 days after surgery. Beyond the first 2 days, most people don't need any prescription pain medicine, and you can take Tylenol or something like that. Aspirin and ibuprofen are an absolute deal breaker before your surgery. If you take those medications, you're going to be a lot more likely to have bleeding that is much more difficult to control during the surgery, and you're much more likely to bruise and have significant bruising after surgery. So don't take those medications before your surgery. You can take them after your surgery. In general, I recommend Tylenol because Tylenol does not thin your blood. So Tylenol is a good thing to use after surgery as well if you don't need the prescription pain medicine. Alcohol and pain medicine do not mix well. Both of those things are broken down by your liver, and you're giving your liver too much to do, and you can cause liver damage if you're drinking and taking pain medicine. So I recommend that you abstain from alcohol for the first 2 weeks after surgery. If you're intoxicated also, you might do things that you wouldn't normally do just using common sense. So I'd recommend that you actually don't drink for the first 2 weeks after surgery. Once you're beyond that early period, then that's okay if you want to have a drink or two and you're not taking pain medicine. Activity-wise, if you had a general anesthetic, you're going to be pretty tired for the rest of that day and the next day as well. If you had an in-office procedure, that recovery is going to be a lot faster, but for the rest of the day, you're probably not going to want to do anything. Now, if you have bandages on or a cast on your nose, you might not want to be out in public, and that's totally fine. You can just walk around your house. But by no means should you be lying in bed. Up and walking around is totally reasonable. At the other extreme, vigorous exercise is not a good idea. Running, cycling, swimming, Peloton, high intensity interval training, weightlifting, no-nos. Don't want to be doing that stuff after surgery because the wound that you have is only held together by sutures, which are very, very weak. So as you heal, that's going to be getting stronger. But immediately after surgery, that's the only thing holding that wound from popping open. So if you do something where you're really getting your heart rate up or really straining, that's just not good, and you're potentially going to put yourself in a situation where your surgeon's going to have to redo that wound and potentially leave you with a worse scar. Now, for those of you who definitely want to get back to working out, 2 weeks after surgery is the earliest you can start to get back to activity, and you want to ease into it. Don't just get right back to the weights on day 14 after surgery. You want to slowly get back into that activity, start running, something light, and then ease back into it. I just don't want you to put yourself in a situation where you break a wound open or develop swelling under the skin because a blood vessel popped open or something like that. And so really, 2 weeks is the absolute earliest, and you just want to ease yourself back into it. Now, your surgeon will go over with you the specific instructions for each surgery that you have, but these principles are pretty much true for most surgeries. So hopefully this is helpful. If that's helpful to you guys and you enjoyed the video, please like the video, and I will see you guys on the next one.